Hello, everybody. We are back with the leadership from Piedmont Newton with our local COVID conversations. Still a hot topic for our communities, schools, businesses, citizens. Just kind of trying to stay on top of things and know where we are and what we need to be doing. Before we get started, I would like to again congratulate Dr. Norris Little, Chief Medical Officer at Piedmont Newton, who was the winner of our Light of the Community Award last week at our annual meeting. You truly have been a light for these businesses and our citizens, and helping us along with your staff there at Piedmont Newton to navigate. So again, congratulations, Dr. Little, on that, and thanks for all your leadership. With that, I'm going to turn it to David Kent to kind of give us an update of where we stand today with some local COVID numbers. So, David?
Thanks, Debbie, and thanks for shouting out again to Norris. I get to work with Norris every day, and I know he's kind of shy and would never want too much publicity around anything he does. So it's been a lot of fun for me to for him to win that award and it to be such a public thing, and to watch him squirm has been really kind of fun. And I appreciate the fact that he won, and I'm really proud of him and thankful that he's here as part of the Piedmont family and in our community, and that I get to work with him literally every day. So kudos again, Norris. I promise to slow down at some point, but I wanted to say it one more time. With respect to COVID, so, the good news is that if you step back and you look at overall community spread, if you look at hospitalization rates and you look at hospitalization raw numbers, we continue to be down far lower than our peak, which happened to us in the middle of January. And I would call our current volume stable. And from an operations standpoint now, we are really into more what I consider to be routine management of people with COVID. We don't have, a very large amount of extra staff that we've had to pull in. If you came to the hospital and we toured you through, which, you're all invited to do, you would see normal operations. You would see people engaging in things that they always have done. And really from a mindset and a mentality perspective at the hospital, we really are now treating COVID just like we would any other infectious disease, like flu, as an example. And even though the COVID and the flu are very different things, I want to make that clear. Very different symptoms, very different, just very different from top to bottom. We are prepared to deal with flu. We wear masks. We wear personal protective equipment. Same thing goes with COVID. And so, I want to sort of put out there for the community and the business community that, we're business as usual moving forward. Now, the other reality with that, getting closer in and looking at the data, the truth is we're not out of the woods yet with COVID. And we have very sick patients in the hospital. Our numbers are not huge, but the people that are affected are really affected. And it's been challenging for them and their families. People are still dying of COVID. And until we can really get this pandemic fully under control with vaccines and so forth, I think, the advice that we would continue to give the public is to stay vigilant. Even though there's a light at the end of the tunnel, we're not there yet. And we need to really make sure that we continue to mask up, wash hands, keep our distance to the extent possible, and certainly practice those behaviors around high-risk, vulnerable populations who haven't been able to be vaccinated yet. So I want to really send that message. There is light at the end of the tunnel, though, Debbie. I saw from the CDC a few days ago, over 70% of people over 65 in the United States have received one dose of the vaccine. That's really encouraging news. And, we've got some time before that same number receives the second dose. So, there's going to be a lag to this, but the more people that get the vaccine, the better off we're going to be, the faster we're going to get back to normal. And I know Norris mentioned, and he can go into further detail, but there just really isn't much evidence out there to suggest that the vaccine doesn't work. It absolutely works. It absolutely prevents severe COVID. It is the best way to protect you. It is the best way to protect your family. And with that, I will kick it to Norris to talk a little bit more about the vaccine, what we're seeing with it, and also where you can get it and how you can access it, and share any other thoughts that he might have. So I'll pass it to you, Norris, for your segment of the presentation.
Great, thanks, David. And thank you to the Chamber for the award. Actually, it's been a very enjoyable working with our community around this very serious situation here for our people. And but I thank you very much. Very, very honored and humbled by that. So I just want to say that, as David said, the vaccination is really effective. I mean, I keep reading increased reports and studies that are coming out related to the effectiveness of the vaccination and prevention of severe COVID, and just want to strongly encourage people to consider it. Sometimes I have people say to me, well, I'm not high risk. I don't have, chronic medical conditions. I'm not over 65. But I want to just underscore that we see other people with severe COVID that are young and healthy, 39, 38, 42. And so this past week, when my 40-year-old son called me about whether he should be vaccinated, and his wife and his they have some teenage children, my response was, yes, you should be vaccinated, because we know that the vaccine's effective. We know the side effects are extremely uncommon, and we know that we see younger, especially with the variants, we see younger patients or younger people getting in severe COVID. And if you look around the world at some of the variants, especially the Brazilian variant, their experience down there is people in their 30s and 40s that are getting severe COVID. So I just want to speak out that that is the way to be protected from this, and we're not seeing significant side effects other than short-term minor kind of aches and pains or low-grade fever sometimes with the vaccine. The other question we're frequently asked, of course, is where do I get a vaccine? How do I get a vaccine? And certainly to date, there have been limitations with supply. The Department of Public Health has been running mass vaccination clinics. Piedmont has been running mass vaccination clinics as we've had supply. And some of the private or drugstores like CVS, Publix, Kroger, Walmart, Walgreens, in various places, but it's been sporadic. So you would check in a Walgreens in one city, they may not have it, another city may have it. So but I would say that within this week and the coming weeks, vaccines should pretty much be available most anywhere. And if you go online to the Department of Health's website, there's a link that will take you to where vaccines are available, and you can search within so many miles of where you live, and then you can click on the places that offer the vaccine and schedule an appointment. So I think the accessibility to vaccination is much better, and is going to be much better here over the next few weeks. The other question I get asked is which vaccine which one's better? Do I take the Moderna? Do I take the Pfizer? What about the Johnson and Johnson? And of course, the Moderna and Pfizer are two-dose vaccines. The Johnson & Johnson is a one-dose vaccine. And although the reported efficacy for the Johnson & Johnson is a little lower for prevention of COVID, they're all pretty much equally effective in terms of prevention of severe COVID. And that's what you're trying to, prevent. I wouldn't be concerned. I mean, if one was available and another wasn't, I would just get the vaccine. And which, whether it was Pfizer, Moderna, or Johnson & Johnson, I think for the prevention of severe COVID, they're equally efficacious, and I would recommend pursuing whatever would be available to you as an individual. And I see the link down here at the bottom of the page, so that's helpful. So that's a good resource for determining where it's offered in your community, and is what we've been recommending people to use. So again, continue to encourage using it. No, from a treatment of COVID, we're still using mostly the same things that we've been using with remdesivir, some biologics and steroids. No big changes. We're still offering some monoclonal antibodies for people that are at high risk for severe disease in the community. With the variants, they've made some changes in the recommendations there, but those are still being offered, and you can still get a monoclonal antibody infusion if you have risk factors or age factors in order to prevent severe COVID. So no big changes on the therapeutic side.
Good, thank you. Do you all have any data of there or through Piedmont of people that are getting that first vaccine, whether it's Moderna or Pfizer, and then aren't getting the second? I know if they don't get the second, they're not considered, I would assume, not considered fully immunized. Is there any issue with people not coming back for that second one?
I have not, and I'm sure that it's happened, but I have heard that that's a frequent occurrence.
Okay.
That people typically are following up with their second vaccination, and we encourage people to do so. There is evidence. I mean, there is protection that you get with the first dose, but there is additional protection from the second dose. So there have been some really good studies out now that show that the first dose gives you protection, but there's still, you're still maybe have a 15 or 20% risk that goes away once you've taken the second dose. So we encourage people to complete the vaccination program, and so far we just haven't seen that as much of a problem.
Okay, good. Any news on any vaccine or mass vaccine locations that'll be local yet?
The Department of Health is working on one that's going to be at well, it's at the technical school.
Georgia Piedmont Technical College.
Yes.
Okay.
And they're working on getting that set up, so that will be a local resource that that Dr. Arona mentioned last week when I spoke with her. Yes.
Okay, good.
That should be up and running fairly soon, within the next week or so.
And when we get that information too, we'll make sure to get it out to the public for sure. Anything else you guys want to add, or I just think staying vigilant, like you've both reiterated, and some of the things that we've been doing, and then as you're available and able to get a vaccine, going ahead and getting that scheduled.
Yes.
Yeah, I would just close, Debbie, with a big thanks again to our business partners out in the community who have, provided us with free meals and you name it over the last year. Feel tremendously lucky to be in a community that cares as much as Covington and Newton County. And, I'm personally, I'm just so grateful to be able to be a part of the team here that is on the front lines of this pandemic. And it's been a tough, but yet inspiring year. And so thanks to all of you out there who have supported us. You have no idea how much it has meant. So thank you.
Yes, and I'll piggyback and on closing with the same and say thank you. As we've reached out to people, there's been no hesitation in helping out the healthcare workers, and for that, I'm truly grateful as well. Thanks for your time, for your leadership, for getting us to where we are today. We're a little over a year out from where everything pretty much, the great pause of 2020, as many of us called it. So thank you. And we will be back on in a couple of weeks. And hopefully there'll be lower cases and higher vaccine numbers. So thanks, guys.